Hey guys, I want to talk to you for a minute about vascular health, and this sort of ties into a couple of different things. One is our arterial age, right? We're starting to measure arterial age here, and we're going to give you a whole mosaic of ages, if you will, as you're working with Apex. But one of the important ones is arterial age, and we get that from the CIMT when we do the carotid scan. We also get it from the endopat test when we put the blood pressure cuff on your forearm and measure hyperemic reactivity and arterial stiffness. We also get some of that information from the max pulse when we put the little probe on your finger and measure it that way. So we know that it's super important to have young arteries to make them compliant, not stiff, make them reactive. This really factors into things like brain health, heart health, of course, sexual health, and it's something that we all really want to be very cognizant of. So some people in Apex who are struggling with a bit of hypertension or new onset hypertension, or gee, I've never had high blood pressure before, are kind of asking, well, what can I do to reverse this? And the first thing is we do this battery of tests for you to see kind of where to push and pull. But I can tell you that there's a common denominator here, and it has to do with getting the right herbs and getting high dietary nitrate into your system. So you've heard us talk about dietary nitrate. That comes from things like kale and arugula and beets and spinach and things that are rich in dietary nitrate. And we've been stressing those in your salads, your smoothies, your omelets, wherever you're putting those. And I think it's really important to get those twice a day. So if you're just getting a salad for lunch, you're probably not getting enough of the greens. You really want to be getting that twice a day. On the other side, there's a group of herbs from the Mediterranean area, summer savory, basil, tarragon. Those three are fantastic for your arteries. There's three other ones: rosemary, marjoram, to some extent thyme also, that also works well for your arteries. And what we want to do is we want to get those into our system. Now, on this side where we're talking about dietary nitrate, you can check your diet using these little test strips. We do it when you come to the office, but many of you have these at home. You just put it on your tongue, face down, just kind of suck on it for about that long, and it should look like that, okay? Nice and red. I think you can see how nice and red that is, okay? Now, I haven't eaten anything today, so this is left over from yesterday. So how am I getting these great strips like this? How am I getting all that dietary nitrate? Well, I'm making a smoothie that's water-based with things like kale, spinach, some bok choy, arugula, and just with water. And I'm also putting the herbs in, which I'll tell you about in a second. And I'm drinking that, just a cup of it, a couple times a day, and I keep it in the fridge. It's not like I try to down the whole thing. It maybe has a few berries in it. I think in this case a green banana, just for a little bit of flavor. And I almost eat it with a spoon because it's very thick. It's not blended, it's more of a chunky, and that's really important. You want to get the nutrients in there that haven't been blended so that they've been oxidized. So you kind of eat it with a spoon, almost like soup, and then drink the juice, so to speak. So that's on that side. On the herb side, these things are amazing. So you know that people in the Mediterranean that eat these high herb diets, and they smoke, they drink, but they also have very active lifestyles, and they're gardening and all this kind of thing. They have very young arteries, and it's really the herbs that are doing the magic there. It's not the red wine, it's the herbs, okay? So when we think about reversing high blood pressure, improving sexual function, improving brain function, etc., we need to get the dietary nitrate right. That's this side: kale, spinach, arugula, all that. But you also need to get these herbs. Now these herbs, basil is killer. It's about an 82% inhibitor of an enzyme that ages your arteries. Summer savory, 89% inhibition of that same enzyme. So these are good. Things like marjoram are around 50%. And so tarragon is about 82%. So anyway, getting these herbs into your diet is important. So I go to Whole Foods and buy these herbs, fresh herbs, and then just strip off the leaves. You don't want to eat the stalks. Strip off the leaves, chop them up, and throw them in that same smoothie with the spinach, the kale, the bok choy, whatever else. It's a little bit of a strong flavor. I squeeze some lemon in it, and like I said, add a few berries. But that's what's actually driving this in toto, and I think it's also allowing my arteries to get younger. I've noticed a change in my own endopat doing this, and I want to encourage you guys to do this too. We also, because it's hard to sometimes find these herbs, we've also created a research formula that we're calling it basically, that we're happy to give out to you guys really if you're interested. And it basically is a tincture. So this is using alcohol to actually pull the essentials out of these herbs, and we're calling it research formula number 1. And you put a dropper full of this into a glass of water or hot tea or whatever you want, and just drink it, and you're getting sort of the essence of those herbs this way too. So we're not actually selling this, we're actually doing this as a bit of a research protocol. So if you're interested in participating in this, we'll be happy to get you set up with it. And anyway, what we're trying to do here is obviously make your arteries younger, make you healthier, and this is the sort of the global approach right now. All right, I hope that helps.